Hello, am I audible? Hello, everyone, and welcome to today's session. Let me introduce myself. I'm Dr. Sumbali Das, your MRCOG mentor at MedInstitutes, and today we will be discussing a high-yield topic from anatomy, which is anatomy of lesser and greater sciatic foramen. I will break it down for you to make it easier to understand, and also I will share some tips to help you to solve SBAs more effectively. So let's get started. Okay, so first thing, what is greater and lesser sciatic foramen? So basically, these are two openings in the posterior aspect of the pelvis. Everything in the anatomy or whenever you are studying anatomy or any other subject, those topics always have a purpose. And when we talk about the modules of MRCUG1, the topics are very, very specific, and all of these topics have to do something with your clinical practice in obs and gynae. So this is a general tip. Whenever you are going through anatomy, physiology, endocrinology, try to relate those topics. I know these are the basic subjects, but they do have some clinical implementations. So try to relate with that. Same goes with this topic. We will discuss some questions which are specifically in the regard of your MRCG1 exam. And according to that, we will cover this topic. In order to understand the anatomy of greater and lesser sciatic foramen, there is a muscle in the gluteal region which is known as piriformis muscle. If you understand this muscle, then it would be easier for you to understand the contents of greater sciatic foramen. And in your exam, there are some questions from the anatomy of piriformis muscle. For example, they will just simply ask you about the attachments of this muscle, or maybe they will give you a picture and ask you to identify the structure. So that's why it is important to have some orientation regarding the attachments of this muscle. So generally, piriformis muscle, it is a flat pyramid-shaped muscle. It originates from the anterior surface of sacrum. It passes laterally to exit the bony pelvis through the greater sciatic foramen, often attaching to the gluteal surface of ilium close to the posterior inferior iliac spine. Insertion, it is on the greater trochanter of femur. Innervation, it is innervated by the nerve to piriformis muscle, and the root value is S1 and S2. Blood supply, generally it is supplied by superior gluteal artery, inferior gluteal artery, gamelar branches of internal pudendal artery. So this is a summary of piriformis muscle, and please look at this diagram. This shows the attachments of piriformis muscle. Please try to make yourself familiar with such muscles. Have a look on the shape of the muscle. It is a flat muscle which have a pyramid shape, and if you can see here, it is inserting on greater trochanter of femur, and from where it is coming from? It is coming from the anterior surface of the sacrum, and it passes through the greater sciatic foramen, and it is a very high yield landmark for this muscle, and that's why this muscle plays a significant role when we are studying the anatomy of greater and lesser sciatic foramen. And after passing through greater sciatic foramen, it will insert it on a greater trochanter of femur. So one thing here, why this muscle is high yield, since it is passing through greater sciatic foramen, so it and when we talk about the contents of greater sciatic foramen, so we have to relate those contents with the course of this muscle. Am I clear? Okay. Okay, Dr. Momna, I always miss my students as well. Honestly, I feel like when my module is over, I feel like something is really missing in my life. Okay, let's move on. What is greater sciatic foramen? In order to understand this in a better way, let's have a look on the pelvic bone. Here you can see there are two notches on the pelvic bone. One is greater sciatic notch and the other one is lesser sciatic notch. And by the attachments of different ligaments, I will tell you which ligament converts and makes which foramen. However, in general way, there are some ligaments of the pelvic bone which closes these notches and convert them into foramen. So the exact anatomical location of greater sciatic foramen is the greater sciatic notch lies between the ischial spine. Here you can see ischial spine inferiorly and posterior inferior iliac spine superiorly. So here we have posterior inferior iliac spine, and here we have ischial spine. And between these two landmarks, we have greater sciatic notch. Now we know that we have a notch here. The sacrospinous ligament, which attaches from the ischial spine to the lateral aspect of sacrum and coccyx, converts the greater sciatic notch into greater sciatic foramen. So now you have three words for the anatomical location of greater sciatic foramen. One is ischial spine, and the other one is posterior inferior iliac spine. These two landmarks stand for greater sciatic notch. And the third thing, which is sacrospinous ligament, this ligament, due to its attachment, it converts this notch into foramen. Now we have a space through which some contents can pass through. The greater sciatic foramen provides a passageway for structures to pass from the pelvis into the gluteal region. So that's the significance of greater sciatic foramen in our body. The lesser sciatic notch, now we have the second notch in the pelvic bone. The anatomical location for lesser sciatic notch, it lies below the ischial spine and it is converted into lesser sciatic foramen by, now we have two ligaments for lesser sciatic foramen. One is sacrospinous and the other one is sacrotuberous ligament. Here you can see this is a better picture which is elaborating greater and lesser sciatic foramen. Here we have a greater one. Now you can see this one again, the notch, greater sciatic notch, which is enclosed and converted into foramen by sacrospinous ligament. Just below that, just below the ischial spine, we have the second notch, which is lesser sciatic notch, which is converted into foramen by sacrospinous ligament from the above and sacrotuberous ligament below. So now for lesser sciatic foramen, we have again three landmarks, but now we have one bony landmark and the two ligaments. The specific ligaments for the lesser sciatic foramen is sacrospinous and sacrotuberous. Okay, please, let's recall quickly. Please tell me the ligament which converts greater sciatic notch into greater sciatic foramen. Please name that ligament of the pelvic region. You have the diagram in front of you. If you want to have a look, you can. That's perfect, sacrospinous ligament. Okay, so now we are well oriented where exactly in the body we have greater and lesser sciatic foramen, how they are being formed, and what is their purpose. The purpose is they allow a way for the passage of contents from the abdominal region to enter into the gluteal region or the pelvic area. So what are those contents? In your exam, mainly question comes from the content of these foramen. So we, on the left side, we have a list of greater sciatic foramen. On the right side, we have a content of lesser sciatic foramen. Now implement the piriformis muscle here. Why it has so much significance? Because the greater sciatic foramen is divided into two parts by the presence of piriformis muscle, the suprapiriform and infrapiriform foramen. So now let's recall the anatomy, the course of piriformis muscle, about its attachment. when we were studying that, we have discussed that it passes through the greater sciatic foramen. And what it does to the greater sciatic foramen, it further divides into two foramen. One is suprapiriform and one is infrapiriform. The name is very simple to remember. The suprapiriform foramen means the contents or the space above the piriformis muscle, and the infrapiriform means the space or the contents which are passing below the piriformis muscle is the infrapiriform foramen. To be more specific, you need to memorize what, yes, in general, you need to have an idea what are the contents of greater sciatic foramen, but more specifically, you should be knowing what are the contents which are passing above the piriformis muscle and what are the contents which are passing below the piriform muscle. So let's have a look. This one is very easy to remember. The things which are above piriformis muscle are superior. For example, superior gluteal artery and vein and superior gluteal nerve. That's it. Infrapiriform foramen have some very important structures, very important contents, which plays a major role in the innervation of pelvic area as well as in the lower limb. And what is the major thing here? We have sciatic nerve, pudendal nerve, inferior gluteal artery, inferior gluteal nerve, posterior femoral cutaneous nerve, nerve to obturator internus, and nerve to quadratus femoris. On the right side, we have contents of lesser sciatic foramen. Since it is lesser sciatic foramen, so its contents are also limited because it has limited space. So what are the contents? Internal pudendal artery and vein, pudendal nerve, obturator internus tendon, and nerve to obturator internus. Please note, if you can see here, pudendal nerve is also passing through lesser sciatic foramen, as well as if you can see here, it is also passing through greater sciatic foramen below the piriformis muscle. Anyone have any idea why is that so?
Ma'am, because it
Anyone?
twists around the ischial spine, it goes out from the that greater sciatic knot and twist around the ischial spine and come to the lesser sciatic notch. Matlab to the lesser sciatic notch.
Okay. So the pudendal nerve first leaves the pelvis via the greater sciatic foramen and then re-enters via the lesser sciatic foramen. And to where it exactly re-enters, basically, pudendal nerve have a major role in the innervation of the viscera or the structures in the pelvic region. So classically, this nerve never leaves the pelvic area. Basically, yes, it exits from the greater sciatic foramen. It re-enters via the lesser sciatic foramen and supply to the pelvic region. Innervate the pelvic or organs, viscera, or any content, which is the pudendal nerve supposed to innervate. Yes, Dr. Sajida, it exits from the greater sciatic foramen and then re-enters into the pelvis because the pudendal nerve is supposed to innervate the contents or the structures of the pelvis area. So that's why it re-enters into the pelvic cavity through lesser sciatic foramen. So classically, it doesn't exits the pelvis and enter into the lower limb. Rather, it prefers to pass through the lesser sciatic foramen and re-enter into the pelvic area.
Ma'am, what about the internal pudendal vessels? Are they not present in the greater sciatic foramen also?
Yes.
Because there's no mention in the greater sciatic foramen in your slide.
Okay, basically, the internal pudendal vessels, they have a different course. They passes through the lateral wall. They basically travels into the pudendal canal and then innervate the pelvic, supply the pelvic area. I will tell you in more detail what are exactly the structures which are exiting the sciatic foramens and where they are going to supply. There are some questions on the exceptional points. Okay, Before we proceed to those slides, in which there are some SBAs, I took some SBAs from the recalls as well. But before that, we will discuss some tips like how you can solve SBAs and how you can score in a better way. Okay, I will share some key strategies to boost your score, and I will tell you some tips and tricks. Okay, so first thing first, what I have noticed in when I observe different students when they are solving SBAs and when they are discussing SBAs, uh, first step is that always read the question carefully and just try to understand the stem. Focus on the key details in the question stem and identify what is being asked. Try to look for the highlight keywords. Pay attention to the terms like what is the most appropriate treatment, what is the first line treatment, what is secondary indication, or what is the likely diagnosis. So these are the keywords which are pointing towards your right answer. Since it is a single best answer, maybe all of the 5 options, maybe they are correct, but you need to identify what is being asked in the exam. Sometimes they will give you some distractors. Maybe they will give you a long scenario, but uh, especially pay extra attention to the last line in which they are asking exact question, like what type of knowledge they are exactly expecting from you. So that's why it is important for you to read the question carefully. Try to pick out what the last line of the question says. Are they asking about the best management? Are they asking about the exceptional points, like all of these are true except one? So sometimes these lines are missed by the students. Even if I am solving some SPS, sometimes it happens to me. I just miss that last line and I just simply lose a simple question. So that's the first tip. Then another thing is that try to eliminate distractors. Look at all the options and start eliminating the clearly incorrect one. This way, you will narrow down your answer, your options, and it would help to save your time as well. And sometimes, if you don't know anything, if you're not sure about the right answer, so this method would help you a lot in that case. Third thing is focus on the core knowledge. Relate the question to your basic concepts in anatomy, physiology, pathology, or pharmacology. And if you're unsure, think about the common scenarios or frequently tested topics. And try to trust your guts as well, because sometimes when you're going through from the option for the very first time and the right options clicks in front of you, and later on when you overthink on that SBA, you get confused. So most of the time, the options which looks correct in first go is most likely the correct answer. So trust your instincts as well. Another issue which students might face when solving their exam, that is your time management. So in terms of your time management, manage your time, aim to spend no more than 1 minute on one question. Just in case, if a question seems difficult to you, mark it. There is an option of red flag in your exam. So simply, if you think that this question you have no idea and it is taking longer than usual, then just red flag that question, skip it, and move on to the next question. And at the end of your exam, review those questions, because at that time you will have an idea like how much time do you have left for your exam. Watch for traps, avoid overthinking. Most SPs have one straightforward answer. Be cautious with the words like no, yes, always, or never statement in the options. Okay, next we have practice on exam-like questions. The recalls are very important. They will help you to understand the format of the exam. It would help you to make sure to have an idea like what is the mindset of the examiner, what type of knowledge they are expecting from you. So recalls are very crucial and they are important, and you are not supposed to write the exam before going through from the exam like questions. So note down my words. The recalls are very important. Try to revise them 2 to 3 times at least before your exam. Another thing is try to answer all the questions. If you have 200 questions in your exam, try to answer all of them, because there is no negative marking in your exam. So you are good to go and solve all the 200 questions. And the last tip is, again, manage time, spend 1 minute per question. Move on if you feel stuck. Just red flag that question. Okay, now we are done with the exam steps. Let's solve some questions, and we will discuss in bit more detail regarding the contents, like what is the difference of the contents which are passing through greater sciatic foramen as well as lesser sciatic foramen. Okay, your first question is, identify which of the following gives the correct pathway of piriformis muscle, its origin, exits pelvis via insertion. So this is the sequence you need to follow. Excellent is the correct answer. Let's look at the diagram again. The piriformis muscle originates from the anterior sacrum, and sacroiliac joint passes transversely through the greater sciatic foramen via the sciatic notch and inserts on the greater trochanter. Please don't confuse yourself with the attachments of, sometimes some students, they might get confused by thinking it is attached, inserted onto lesser trochanter of femur. But remember, it is from anterior sacrum, pass through the greater sciatic foramen, and then inserted onto greater trochanter of femur. Your next question is, the only structure that exits lesser sciatic foramen is which one of the following? Okay, so the correct answer is C here. Let's have a look why. Internal iliac artery is not the content of lesser sciatic foramen, so it is completely ruled out. Then we have nerve to obturator internus and pudendal nerve. Yes, both of them they are the content of lesser sciatic foramen. But what happens? These nerves, yes, they passes through the greater sciatic foramen, but they doesn't classically leaves the pelvis. They just they passes through the lesser sciatic foramen, but re-enters into the pelvic area. So the only content we have is the tendon of obturator internus, which exactly classically exits the lesser sciatic foramen. So the tendon of obturator internus is the only structure that exclusively exits the lesser sciatic foramen. Other structures such as pudendal nerve, nerve to obturator internus, they passes through the greater sciatic foramen first, then re-enter the pelvis via the lesser sciatic foramen. I hope that makes sense to you now. Let's have a look on, since we have discussed about the pudendal nerve, now let's discuss about the nerve to obturator internus. It originates from the anterior division of fifth lumbar to second sacral nerve. The root value is L5 to S2. Its course exits the pelvic cavity through the greater sciatic foramen, winds around the ischial spine to enter perineum via the lesser sciatic foramen, and comes to lie on the medial side of the obturator internus. So this is the course of obturator, nerve to obturator internus. So the tendon of obturator internus is the single best answer here. Your next question is, which muscle divides the greater sciatic foramen into superior and inferior component? Yes, it's the correct answer. And we have already discussed about this point, what is the significance of piriformis muscle and what exactly it is doing with the greater sciatic foramen. So this one was an easy question. Okay, so your next question is, which of the following structure passes through both the greater and lesser sciatic foramen? Okay, now you can compare. We are just studying the contents of greater or lesser sciatic foramen, but if you can compare how simply just changing one word can change your answer. Now they are talking about the content which is passing through the greater and lesser sciatic foramen. So there could be many contents, but yes, here the answer is pudendal nerve. And if we can go on the previous slide, this question, this is also talking about the content of lesser sciatic foramen, but now you can see the keyword here. The keyword here is that only structure and the exit word. And most of you gave the answer of pudendal nerve, but here this is not a suitable answer. But now here it fits better. So C is the right answer. Well done. Okay, this topic was a demo topic, like how you can study a topic. For example, if you are going through from the Oxford, or if you are following any other book like Essential Revision Guide, or maybe any notes or anything. But this is a pattern you need to follow. Like this is a theory topic, and then compare the SBAs, like what type of questions are being asked in the previous exams, and try to solve them. So if you study this way, this is a tip for the students who are going to sit in the exam in July 2025. And also, those students who are writing in January and they're still going through from the theory and trying to work on their basic concepts. So this tip is very helping. It would save a lot of your time because it is not possible for anyone to just memorize all the points which are written there in the books. So this is a precise way. Just go through from the topic and just solve the relevant SBAs. Just try to memorize the high yield points. In that way, you will save a lot of your time and it would help you in the exam in the longer term. Okay, I wanted to share some happy faces from our previous batch who followed the same pattern. They followed the same tips and tricks, and by following that way, that pattern, they all passes with a very good percentage. And most of the students in the previous batch, they scored more than 80%. Sure, I will show you the first slide. Let me go back. Okay, are you asking about this slide? Dr. Momnat, this slide is about just an overview about the greater and the lesser sciatic foramen. In the next two slides, I have shared a better picture, a more precise picture for greater and lesser sciatic foramen anatomy. Okay, so let's go back. Okay, so these are our students from our previous batch. Who took our premium course and our power hour course, and specifically many of them, they took our workshop, which is a 2-week workshop on the recall practice, and they found that workshop very helpful because no matter what you studied in the beginning month, the actual thing, the knowledge you actually retain for the exam is your practice and your hard work, which you spend during the last month of your exam, because that is the time when you're revising everything and there's a lot of panic and a lot of mess is going on. So that is a very crucial time because at this last month is very important. Whatever you remember in this month will help you in the exam definitely. So here are some more happy faces. So all of them, they were very happy. They passed the exam in first go. We had 100% result in our previous batch, and all of them, they followed the techniques we have shared with them. We provided them with the lectures. We provided them and guided them throughout their journey and helped them to how they can smartly study for the exam and they can ace it. Because this exam, I repeat, this is all about the smart study. The more you study in the smarter way, the more are the chances for you to pass the exam. And yes, if you just pay some extra attention to the tips, like what are the points you need to pay extra attention to, if you work on your weak areas, you can definitely score like these students who scored more than 80%. So these are the tips again. Organize your notes. This is your my 1 month tips, like what you can do in your 1 month. Organize your notes, whatever you have studied so far from the last 3 months or 4 months or so on. Sort your notes by high yield topics because mainly the paper comes from the high yield topics. So divide your notes according to the syllabus, topics like anatomy, physiology, pathology, embryology, biochemistry, genetics, and biostats, or whatever modules you have. Create your summaries. Summarize each topic in your own words. That would help you to reinforce your understanding. You can use some active learning techniques, like, and you can follow the flashcards. If you have made one for you, then definitely you can spend some time, like if you during any time, for example, you are at hospital and you have some 15 to 20 minutes for you, you can go through from the flashcards. Quiz are very important. Regularly test yourself with practice question and past papers. So if you do not have the content, organized content for you, we have that. We have solution for that. We have online mock exams. We have major mock exams. You can. We have for separate mock exams for each module. As you can see here on the left side, we have a separate mock for anatomy, all the modules. Then at the end, we have a 3 combined mock exams, which exactly looks like your exam. So if you do solve these mock exams, that would help you to assess yourself. And once you know your weak areas, you can work on them. Also, you can use multiple resources like textbooks, refer to standard textbooks which are recommended for MRCG Part 1, like Oxford Vision Notes, Essential Vision Guide. Then you can also take some online courses and lectures, but here I want to alert you that please do not fall into any scam. Try to follow the courses or any course you are taking or you are thinking to take. Make sure that that is authentic and they are not misused your money, because time and your money, they are important, and that your time is way more important. And I'm still a student, and I know how difficult is that to write international exams, and since we all are working, so managing time out of your working hours for your studies, they are very 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 significant thing, and we cannot risk them. We cannot risk our time and we cannot risk our money. So please make sure whatever course you're about to take, please make sure that is authentic and they are not wasting your money and your time. Then you can use some question bank for your division. If you want to follow any online question bank, that's good. If not, then we have some books in the market like PassMR, COG, we have Catherine, we have Angiosizer. So there are many books in the market. So you can also follow them for your practice. Then in the last month, you need to have a schedule. You need to revise all the modules in the very systematic way. So make your timetable. Try to take some regular breaks during the study time, because it would help to avoid any burnout. And seriously, I need to follow this tip as well, because I don't know, this is a toxic trait about me. Whenever I start studying for any exam, I just start studying straight for 8 to 9 hours. And after 3 days, I'm burnout. So I need to follow this as well. So another tip is active recall and spaced repetition. Test yourself on the material rather than passively reading it. So challenge yourself, make your reflexes, give you a chance to solve the SBAs. So don't be afraid of solving SBAs. If you don't know the answer, don't worry. This is your practice. Spaced repetition, review material at an increasing interval. For example, if I take anatomy, it is very volatile. Endocrinology, again, it is very volatile. So for example, if you have studied on the 1st of January anatomy, then try to revise that on an interval of 1 week or maybe 10 days, so that you can retain that. Another tip is that group study and discussion. This is very helpful, because when you discuss with your peers and colleagues, the SPAs you have discussed with them, it would remain in your memory. So this is a very helpful tip. So try to have a study partner. Try to discuss any ambiguities, any questions in the groups. Join a study group to discuss difficult concepts, and explaining concepts to other people also helps for your understanding. So if you're helping someone, that is also a good thing for you as well, and for them as well. Once you have solved the SBAs, and once you are solving different SBAs from different resources, and at the end you know that, try to identify your weak areas. For instance, you can assess yourself by solving SBAs, and you for example, if you are solving SBAs from a subject-wise mock, and you compared your percentage and you found that your percentage in the biostat is very low, that means it is your weak area. So you need to pay extra attention on biostats. So this is just an example how you can identify your weak areas. and how you can work on that. You can also take professional guidance, like you can again take some courses, or you can take some tutors, or you can follow the advice of your mentor. Consider enrolling in professional revision courses or hiring a tutor if you need a structured guidance. But yes, again I endorse this thing that make sure you're following the right track, you are following the right people, because when you take multiple opinions from different people, at the end of the day, you are confused. So please make sure to which direction you are following. Mentorship, seek advice from colleagues or mentors who have successfully passed the MRCG Part 1 exam. For instance, if any of your colleague in your hospital who already passed the MRCG 1 exam, try to discuss some things with them, or maybe take some tips from them, like how they studied for the exam and how they passed the exam. So this is very useful. Time management, we have already discussed this. Try to spare 1 minute for each SPA. Read question carefully, identify and solve easy questions first. This would, even during the exam, this would give you an idea like exactly where you are standing in your exam performance. Uh, um, this works like that. If you solve the easy question first, on which you are sure about, you know the answer, and red flag those questions on which you are not sure about the answer. And the end of the exam, they will show you a list of the questions you solved in the first go, and there would be another list for the questions which are red flagged by you, and there would be a third list in which you never attempted a question. So the questions you have solved in first go will give you an idea like where you are exactly standing in your exam performance. Then we have exam techniques like, again, manage time efficiently, mark difficult questions, and stay calm and focused during the exam and even during your practice time. Okay, so what we mentor recommend, practice year-wise exam type questions. This is very crucial for your exam. You are not supposed to write the exam before going through all the recalls. So this is very important. And honestly, it would cover more than 70% of your curriculum. Watch exam-oriented lectures to wind up your exam preparation. Solve as many as SPAs as you can. Must take mentor's advice while solving questions. Must solve mock exam before entering to real exam. So here's the good news. We are going to start our recall practice session. This is our workshop, which is for 2 weeks. And during this workshop, we are going to cover all the recalls from the last 5 years. And benefits of this workshop is intensive discussion with the mentor on Telegram group. Correct key with explanation will be given along with mentor supervision. It would help to enhance your concept with recall of 2019 to 2024 exam type practice. Mentorship and backend team service available till your exam day. So if you enroll in our workshop, which is for 2 weeks, you will get these benefits. And please try to book if you are interested, try to book your slot as early as possible, because we have limited time. We are starting our workshop or from December 16 on Monday. Thank you so much for bearing with me so far. If you have any question, you can ask me. Thank you so much, Ibrahim. Dr. Lubna, don't worry. I'm always on the back. Welcome, Dr. Prajakta. Okay, Shreya, that's a very wonderful question. I have a good news. The passing percentage of MRCG1 exam is very good. Usually, uh, the, in the last year, up till last year, the passing score was around 65 to 70%. Like 65 to 70% passes the MRCG1 exam in their first attempt. So this is a very good percentage. For MRCG part 2, however, for part 2, it is quite low, but for part 1, it is quite good. How many? Okay, the question is from Maysara. Her question is how many questions will come from statistics? Okay, this thing I think the only examiner should know in the answer because the MRCG1 they do not have a crystal clear criteria like how much. Yes, they have provided a rough sketch like how many questions are coming from which module, but in the exam they classically do not follow that criteria. So it's all up to your luck, like how many questions you are getting from biostats. I got roughly around 8 to 10 questions from biostats. But there are some tips for biostats, like what I actually did. The biostats were very difficult for me because I'm already poor in maths. So what I did, I just memorized the high yield topics. Like I thoroughly studied about sensitivity, specificity, some important formulas like maternal mortality ratio, how to draw 2x2 table. And there's a list of formulas which we need to calculate from 2x2 table. So I think there are 8 formulas. So I just did that thoroughly because I don't know, I was sure that I must get some questions from that topic, and I got 4 questions from that topic. So that helped me a lot. Dr. Lubna, the important thing you are not supposed to miss from biostats, and I'm still sure you will get some question from sensitivity and specificity. So have a good understanding of that topic. Try to practice maximum 2x2 table, like how you can draw it, because if you draw your 2x2 table in the right way, you can easily solve your question. Oh, that is easy. Study design is easy. They are just basic definitions, and that is the foundation of biostats or epidemiology. So one thing you can do, if you are going to start biostats, so start from the study design. What is cohort study? What is case control study? What is observational study? What is randomized controlled studies design? These things are important, and there's a pyramid like which study design is over which study design. So that pyramid is important, and once you are done with those definitions, you are good to go and move on to the next topic. Ishwarya, basically, the last 5 years recalls are way more important. Uh, if you have time and if you want to go through from the previous recalls, then you can go with the 1993 recall as well. So it's all up to you. But if you notice, take one paper and try to compare it with the recent 5-year papers, and you will see the trend, how the similar questions are going to repeat and appear in the coming exam. Maybe not the exactly same, but the topics would be similar. So ultimately, if you cover the last 5-year recalls, you can cover all the modules. So don't worry about that. Okay, are we done with the question answer session? Okay, so goodbye, everyone. Thank you, Dr. Momna. Wish you a very best of luck and study hard in this last month. This is very crucial. And I also want to share your happy faces in for the coming batch. Goodbye.